Hi, my name is Jose Atangan, and I will be discussing about conjunctivitis for today. So, conjunctivitis, it is an inflammation of the conjunctiva. It may be caused by bacteria, viruses, allergies, or chemical irritation. The inflammatory response produces redness, edema, pain, and lacrimation. So there are different types of conjunctivitis. So the first is bacterial conjunctivitis. So this is highly contagious and it is often caused by a gram-positive organism. Viral conjunctivitis, it is caused by an adenovirus. Allergic conjunctivitis is associated with a variety of antigens, including pollens. Chronic conjunctivitis is the result of any persistent conjunctivitis, and the last type is chlamydial conjunctivitis that is caused by Chlamydia trachomatis, and it is associated with poor hygiene, and this is also the leading cause of preventable blindness in the world. So pathophysiology of conjunctivitis, so it starts with the allergen, the bacteria, virus that enters the tear film. So this is the barriers of the eyes. And so those antigens binds with the conjunctiva mast cells that produces IgE antibodies. Then there will be the granulation of the mast cells that can lead to first is the release of histamines that can cause itching of the eyes, redness, and increase mucus secretions. And with the granulation of mast cells, there will also be a release of prostaglandins and leukotrienes, and that will lead to itching of the eyes, redness, tearing, and mucus secretions. And the last is with the degranulation of mast cells, there will be an activation of the platelet factor that will cause eye swelling or redness. The common signs and symptoms of conjunctivitis are ocular itching, redness of the eyes, ocular swelling, tearing, and photophobia. So for diagnostic tests, generally, diagnostic tools may not be necessary in non-severe conjunctivitis because of the benign and self-limiting nature of most cases. But there are also some um, methods that are available to identify the infection. So the first method is the cells culture. It uses a confirmatory immunofluorescence. Um, most of the literature say that this is the gold standard test for conjunctivitis, but it is not widely used because of its time-consuming process. And another method is the PCR, which is the polymerase chain reaction, and this is using a serologic method. So this method has been broadly used because it exhibited better sensitivity compared with the cell culture. But PCR is also not a preferred test for screening because of the delayed time for the results, which can take up to 4 hours, and also because of the technical expertise and the expense for the instrument. Another method is the antigen test, which uses an enzyme immunoassay. And based on my reading, this is the preferred test because it provides rapid results with high specificities and acceptable sensitivities. For the plan and treatment of conjunctivitis, So for non-pharmacological methods, first is we want to make sure that the patient will avoid having in contact with the allergen. And another thing to do is we can also apply some cool and warm compress to help reduce swelling and provide comfort. And also we want to provide adequate eye care so we can remove the crust, the drainage, or the pus on the eye. And we just want to make sure that we educate the patient to make sure to use different washcloths for cleaning both eyes to prevent spread of infection. For home remedies, based on my literature reading, flaxseed is work to reduce the inflammation and soothe eye pain. And also tea bags such as chamomile. It helps soothe the eyes and reduce swelling and redness. And the most important thing is to hand washing. So that this is the best way of preventing the spread of infection. So for pharmacological methods, we can start with artificial tears. This can help provide barrier function to help improve the first-line defense at the level of conjunctiva. This helps dilute and flush the allergens and the inflammatory mediators that can be present on the eye surface. Antihistamine is the mainstay management of conjunctivitis. So it affects rapidly in relieving ocular inflammation when it is applied topically to the eye. And La Rosa and other authors states that a combination treatment using decongestants with antihistamine have shown to be more effective. Decongestants act primarily as a vasoconstrictors and are effective in reducing erythema. So these treatments are suitable only for a short-term use. And it is interesting because I found another literature where Wedge and other author concluded that decongestant causes medication-induced conjunctivitis as a result of a rebound effect of the vasodilation when the drug is discontinued, which they don't recommend for providers to use decongestants to relieve symptoms of conjunctivitis. Another med that can be used is the anticholinergics such as cyclopentolate. So these are drops that can be prescribed if patients are experiencing eye pain. So this helps to relax the muscle of the eyes. And antibiotic agents such as erythromycin ointment, tobramycin drops, and ciprofloxacin can also be initiated for conjunctivitis. And Wedge and other authors also suggested that no topical medications containing corticosteroids should be prescribed for red eye in primary care because this can aggravate herpetic disease, causing ulceration and scarring of the cornea that can lead to vision loss. So here are the references that I used for my presentation. And if you guys have any questions or clarifications, please let me know through the chat box. And thank you for listening.